In 2017, legendary golf champion Tiger Woods underwent a fourth surgical procedure on his back to relieve debilitating pain that had been plaguing many aspects of his life for years. After 3 previous surgical procedures that failed to provide complete relief, the results of this fourth surgery were nothing short of life-changing. As he set new world records, won his first major PGA tournament in 11 years, and most importantly, regained his ability to be active with his family. Which all begs the question, why did this particular surgery work so well? This is Dr. Richard Geyer of Plano, Texas, whose team performed Tiger Woods' life-changing spine surgery in 2017.
Well, he's like any of my other patients. We end up doing surgery. Their quality of life is such that they can't do the things they like to do. You know, in his case, it was golf and spending time with his kids, and he was a typical, patient where the quality of life just really was not where he wanted it to be, nor should it be.
After years of repetitive motion, the shock-absorbing disc between bones in Tiger's lower spine had steadily become worn down and compressed, leading to pinched nerves which generated extreme and constant pain.
Nothing would ever take the pain away. And the thing that I wanted to do was just have that pain down my leg or have my foot work again. I would look at it and it just wouldn't move. And the searing pain going down my leg from my hip all the way down, it just would never leave. And at 24 hours, 7 days a week, it adds up. And it took a toll on me.
To relieve the pain, Tiger chose to undergo a common procedure known as spinal fusion. But not just any spinal fusion.
The procedure that we did on Tiger was a minimally invasive anterior lumbar interbody fusion.
Let's pause and break that down. Anterior, meaning from the front. Lumbar, meaning the lower spine. Interbody, meaning between the bones. And fusion, which means to join together. The anterior lumbar interbody fusion, or ALIF, as it is commonly known, is a procedure that has been in use for roughly half a century. Here's how it works. A surgeon accesses the spine from the patient's front via natural separations in the muscles, rather than cutting through the bones and major muscles in the back. Then, the damaged disc is removed and replaced with a spacer intended to restore the height between the vertebrae, or spinal bones, limiting the motion between them and relieving the pinched nerves.
There are many other fusion options, but they would have involved either going in from the side and then putting screws in from behind, again dissecting the paraspinal muscles. And his trunk and core strength is so important for what he does. We all felt that this was the best option for him to do this minimally invasive anterior lumbar interbody fusion.
In other words, by performing the procedure from the front, the surgical team was able to spare Tiger from damage to back muscles, which are so vital to an active individual. But Dr. Geyer took a further step towards ensuring Tiger's successful outcome. He chose a spinal implant product called Stay-Lift, a technology that has a 30-year clinical history with over 75,000 devices implanted worldwide.
I use the Stay-Lift because it's stable, it's effective, and it's safe. I've used many other products. This one, I've never had an issue with a screw being misplaced or near a nerve. I needed something that was safe and effective and had a proven track record.
Stay-Lift provided Dr. Geyer with added confidence due to its time-tested 3-screw system, which secures the implant in place while simultaneously compressing the implant to the bones above and below the device, eliminating abnormal motion and increasing the opportunity for fusion. To fully ensure a successful fusion, the particular Stay-Lift variant chosen for Tiger was Stay-Lift M-Tie, which features a microporous and texturized titanium surface that has been shown to aid in the fusion process.
Because it's like the moonscape with peaks and valleys. Bone cells love to grow into the peaks and valleys. So in my way of thinking, we have 3 ways that it's going to heal. First, the screws hold it in position, the titanium allows the bone to grow to it, and then the biologic allows the bone to grow through it.
Together, these trusted and proven procedures and principles, combined with an innovative technology, have enabled one of the greatest comeback stories of our time.
The nerve pain is gone, and it's been gone ever since the spinal fusion surgery. If my kids want to do something, I can do that again. And there was a period of time when I couldn't do any of it.
For Tiger Woods, regardless of what successes and championships lie ahead, his comeback story is complete. He has truly regained his life.
It is quite remarkable that my life has changed and have come from hopelessness to one of hope and prosperity.